Now that we've talked about nursing in the future, or the future of nursing, and the definitions of a nurse, we'll talk about the definition. So, one strategy to describe a field is to categorize it by profession, occupation, or discipline. These are the criteria for a profession as defined by Starr in 1982. These are in your textbook. According to Starr, you need to have technical and scientific knowledge, be evaluated by a community of peers, have a service orientation, and a code of ethics. So if these are the criteria, do you believe nursing is a profession? We also have been referred to as an occupation in nursing. Um, Occupations are typically places where an employer dictates the conditions and work duties and would be typically paid by the hour or shift work. So blue collar working is considered an occupation. So these are arguments for being an occupation. The other argument is that nursing is a discipline. A discipline should have a domain of knowledge. There's theoretical and practical boundaries. In nursing, theory defines what it is that nursing does. Caring is an essential role in every component of nursing and all theories. Evidence-based practice guides our decision-making processes, and it is practical in that we have current knowledge and research. So essentially, we fall into all three definitions, but I do think nursing is a profession. One of the ways we can improve being recognized as a profession is to do these things. So these are the standards that were basically talked about in that Institute of Medicine report. So standardizing the educational requirements for entry into practice, uniform continuing education requirements. Each board of nursing in each state has a different requirement for those continuing education. We could increase participation of nurses in professional organizations and then educate the public about the true nature of what it is that we do, like we've been talking about. This leads us right into current entry into practice for nursing. So in nursing, you can enter into practice in these 6 different ways. Yes, I said that right. You can enter into practice, no patient experience with a doctorate if you like school a lot, right? The diploma programs is the easiest way to get into nursing. These started in the 1800s. They required 3 years of clinical and practice with patients. A lot of people began working and then ended up with a diploma. And interestingly enough, in 2014, 4% of new grads in the United States were diploma nurses. The ADN, or associate degree nurse, was started related to the nursing shortage after World War II. And these programs seem to grow when there are nursing shortages because this is a 2-year degree. These nurses have some liberal arts, but it's more of a skills-focused program. These programs actually do better. Their students do better on the NCLEX exam because it's clinical decision-making. And so about 58% of nurses in 2014 entered into practice with this degree. The Bachelor's of Science in Nursing is the 8-semester program that you know. We make sure that students have a liberal art background, and BSN students are prepared for complex clinical situations. We focus on leadership and management and theories in nursing. In 2014, 43% of new grads held a bachelor's degree. And if you remember last week, I talked to you about the Institute of Medicine's push for 80% of nurses with a BSN, and Idaho was leading the way in that category. We also have RN to BSN nurses entering practice. This is up about 86% from 2009 to 2013 because many institutions became magnet status institutions, And this magnet status said that they did several things as an institution. So focused on having nurses involved in decision-making processes. And so they started to require nurses to get a bachelor's degree. And so many students were going back. We have an RN to BSN degree for students here at LCSE. It is completely online. A master's and a doctorate are generally reserved for secondary or like education or nurse practitioner, nurse anesthetist, so mid-level providers, but some nurses do enter straight into practice with a master's or a doctorate degree. This talks a little bit more about those degrees. So with a master's degree, you become more independent and autonomous. You could be a clinical specialist, so working on a unit, but you would be the person in charge of education for that unit. You might guide research on a nursing unit. You have to have a master's degree to be a nurse educator, a nurse practitioner. You should be master's prepared to be an administrator, and definitely you must be in order to be a nurse anesthetist. Now, to do these things, you also could have a doctoral degree, and so you could get a DNP, you could be a doctor of nursing anesthesia, or have a doctor of philosophy in nursing additionally. So formal education is considered continuing education. This is different than in-service education. So I want you to make note of that, especially for the exam. Continuing education is a professional strategy to maintain your clinical knowledge or to obtain knowledge. And like I mentioned, many states require continuing education for renewal of a nursing license. Not all do at this time. In fact, Idaho just adopted that in the last 5 years. In-service education is education that you should be getting at the hospital when you have a new policy implemented, when you get a new piece of equipment, the way you do assessments, those kinds of things would be in-service education. And I would encourage you to seek those out. You will gain leadership opportunities by being the provider of in-service education. And definitely, these shouldn't be considered optional. When you get a new piece of equipment or have a new policy, it's our job to be competent in those. So I think that all nurses need to value this type of education, even if it doesn't count towards your degree. So you guys have probably seen this model, Benner's model, and you will see it throughout your time here in our program. Informal education happens in nursing, and it's called socialization. And socialization is actually huge in the profession of nursing. This is a good thing, but it can be a hindrance too, because doing things the way they've been done, because we have always done it, is not always good for moving forward, improving patient quality and safety. But it is awesome to have a way to enter into the profession knowing that you're going to get information. Socialization is gained from direct experience, observation, and informal discussions with peers and colleagues. So you will recognize that socializing is why we have you in the clinical setting from the very first semester. It's why we put you in simulation groups and clinical groups, and it's why we put you with a nurse on the floor. It's why when you graduate, you're going to be with a nurse, because learning from somebody is really important. So Benner's model says that we have 5 stages, and these are truly how some facilities will work. So as a novice, you're learning the rules. You guys came into the program as a novice. You would have little to no experience, and so it's really black and white that you need. Your ability to think outside the box is limited because you don't know what the rules are. And we know it's limited. It's not bad that it's limited, but this is the problem when you're a novice and different instructors do things different ways. It's hard for you to grasp because you think they're telling you different rules, when in reality, the rule is that a thing must remain sterile. how it remains sterile can look different ways, right? How the Foley catheter, like how you hold it before insertion, can look different ways. But the rule is that it must remain sterile. And so a novice really has to work these things out. So it's not unusual that we have those complaints and see those experiences. Stage 2 is the advanced beginner, and this is how many of you will begin to function as you graduate. An advanced beginner begins to focus more on aspects of a clinical situation. They can use facts and sophisticated use of the rules to recognize similarities in situations. They can distinguish abnormal findings, but might not be able to understand the significance of them quite yet. And then stage 3 is when a nurse achieves competence. So this is usually 2 to 3 years of nursing practice in the same area. That's super important here for you to understand. That's why we don't recommend going to the float pool or going to the ER when you're a new grad, because in order to become competent, you need to see things over and over and over. You will still get competent, but it might take you longer for different things. Competent performers have gained additional experience and they can wrestle with complex concerns. These are nurses who start to question, why are we doing it this way? There is a better way. I read about it in my magazine, right? My professional organization magazines. Competent nurses can handle their patient load and then prioritize situations. They're more involved in the caregiving role and start to be emotionally involved in the clinical choices made. So start to have opinions, start to want to lead generally. And then stage 4 is a proficient nurse. This nurse is who we should be putting students with. This nurse can quickly take in all aspects of a situation and immediately give meaning to the cluster of assessment data. This person is a resource for less experienced nurses. They can see the big picture and can coordinate services and forecast needs. So these would be charge nurses or nurses who have been there 4 to 5 years and beyond, right? Stage 5 is an expert nurse. So these nurses can see what needs to be achieved and they know how to do it. They know the resources that are available to them and who can help them usually. They trust in and use their intuition while having a deep understanding of a situation. They can recognize a problem even in the absence of clinical signs and symptoms. And they usually have expert skills, so they're consulted when others need advice or assistance. This person is a great person to be on the rapid response team because they can guide the newer nurse to make a decision. And so they're a very, very valuable nurse.